Good Sunday morning to you. Some folks will call it Lions Victory Day. I'm just projecting out, but welcome to Lori Stories. I'm Lori Pinson, your host, and welcome to my little corner of the stream. Now, for today, we are going to really be getting into it, and I see that some of you are online already excited about it. Joyce, Dennis, Pete, Donald, Darla, I want to welcome you in and everybody else who's found us today. Today, we're going to be talking about acupuncture, and maybe you have experienced it and maybe you have not. So as we think about conventional medicine versus holistic medicine, I'm wondering, are you one of those people that are trying to get away from pharmaceuticals? Maybe there's something on you that is really hurting and you don't want to take that extra step of doing some surgery. You're tired of taking additional medicine for it. Have you considered holistic medicine or Chinese medicine? Are you trying to get away from it? More so Chinese medicine coming to the forefront. And what do you think when I ask you to consider the possibility of acupuncture? What does that do for you? What does that make you think? Is it something that you would even consider? Well, fortunately, joining me live this morning is an expert who can talk about it. I've got Dr. Daniel Devine here with Corewell Health. He is an acupuncturist. Welcome so much. Thank you, sir, for coming in.
Good morning, Laurie, and thank you for having me.
Absolutely. So first of all, tell me, what is the difference between, I guess, traditional medicine versus Chinese medicine? And how do you practice it?
Sure. So we would refer to like the conventional side of things would be like where most everybody in the United States is familiar with. They would go to their doctor. They might get referrals to specialists. They see the nurses. They see their medical assistants. This is all part of the standard, what we call conventional medicine track that we're all pretty familiar with. And oftentimes that includes treatments that would be like pharmaceuticals, physical therapy, could be, basically referrals to specialists to get, specific diagnostics and such. The holistic side that you're referring to, traditional Chinese medicine, looks at things a little more holistically, like I just mentioned. And we want to bring something in addition to the conventional side of things. So we're not necessarily trying to get people to stop their pharmaceuticals if that's working, if that's what's important as part of our healthcare. But we might be able to add some additional things that maybe hasn't been seen or looked at that might also benefit them. So that might include like acupuncture. In traditional Chinese medicine, we also look at herbs and other components that we bring into it too. We're starting to refer to this as integrative medicine, which also includes other types of modalities or disciplines, such as functional medicine and lifestyle medicine. We have integrative nutrition, we have yoga therapy, we have clinical massage therapy. These are all part of what we call the integrative model that we bring here at Corewell Health as something that we can offer, including acupuncture.
So tell me, what is it that made you decide to not take the conventional way and that you wanted instead to do the practice of acupuncture? What's your background with that?
Sure. So I was actually as a pre-med student when I was in college. My intention was to go through the conventional track of becoming a physician. I also had the benefit of working as a ER technician at the time, and it was a teaching hospital, so I got the exposure of seeing what residents and students and various future physicians were, how they were being trained. And this was many, many, many years ago, so it felt to me at that time kind of restrictive. There was a sense of like you couldn't think outside the box, and it didn't seem very holistic in that sense. Things have certainly changed since. A lot of the medical students that I'm exposed to now have a broader, perspective. So it's fantastic that conventional medicine is starting to broaden their scope. But, at that time, I wanted something a little more holistic, and it just didn't appeal to me to go down that track, spend many years and be in severe debt that I wasn't going to appreciate. So I started looking outside the box myself in terms of what could I get training in. I certainly wanted it to be in a healthcare industry of some sort. And so I ended up finding traditional Chinese medicine and acupuncture. I had a little exposure to that when I was in college, some of the concepts of what acupuncture was. So it planted the seed, and the more I looked into it, the more I felt this was the right path for me. So this is how I ended up going in that direction.
Well, thank you so much for sharing your wisdom with us. We need to talk about acupuncture.
Sure.
Exactly. When people see acupuncture, especially people that are afraid of needles, I'm not sure they really understand what it is. Now, the way that you explained it to me is that it's operating in blockages in the flow of chi, or tell me exactly what are they doing when he's moving that needle in her face. I'm sure our viewers are squirming just a little bit, but it doesn't hurt, or just break it down for me. Tell me about it.
Sure. So yes, there's what I refer to as two different modes of explaining how acupuncture works. There's the traditional Chinese medicine model of how it works, which is what you're referring to as the flow of qi. And I'll explain that a little bit.
Okay.
But just I want to touch base on the idea that the other way of explaining this would be through more of a conventional science perspective, which is where scientists actually research, they do experiments and look at like the effectiveness, and they also come up with their own mechanisms based on science as far as how acupuncture is working. They refer to this as evidence-based, which is important in terms of promoting acupuncture in the mainstream. And so we definitely see that in the science concept, there's an effect on both the hormonal aspect as well as the neurologic aspect.
So are people, I mean, you obviously have studied to know where these needles should be inserted and what type of a response you get. Um, is the response what you anticipate it to be when you're putting the needles in? Like I'm looking at these needles go down appears to be someone's spine.
Right.
So there are different points on the body where you would actually insert these needles for specific results.
Sure. And the points are in the traditional Chinese medicine model, they follow certain maps, or what we call meridians or pathways, kind of going back into the idea of this flow of qi. Just in general, when we see that the flow of qi, which is this hard to define substance because science really can't pull it out and measure it from the
Right.
body. But in tradition, going back thousands of years, they understand that this concept of qi is what keeps us healthy. It's our vitality. And so if it's flowing in a nice, smooth way in the proper balance, the person is generally healthy. If it's obstructed in some way or blocked or out of balance in some way, then a person exhibits symptoms, and therefore they're starting to show some effects of not being healthy. So the intention of the acupuncture is to help stimulate the flow of this qi and restore its balance and smooth flow. And when that happens, a person's health generally starts to improve. The symptoms start to go away.
Now, you did talk about if it's something like, say there's bone on bone in a knee or something like that. Obviously, acupuncture can't restore the tissue in there, but when people get something like that done, they're getting it done to relieve pain. Is that mainly what acupuncture is for, to relieve pain?
It's probably pain is probably the most common reason people have seek out acupuncture, or maybe is referred to acupuncture by their physician. But it's not the only reason. There's other things that can be addressed with acupuncture, such as stress and anxiety, depression, nausea, vomiting, gastrointestinal issues. There's a wide range of things that can be addressed by acupuncture, but I think pain is probably the most common in terms of what people are likely to experience or go for acupuncture.
So we're looking at the technique here. Is it typical where they are pushing them in and turning them around? What is the purpose of doing that? Or is that just that particular acupuncturist style?
Right. So acupuncture itself is very diverse and flexible in terms of how we administer it. So literally, we all develop our own sort of style of how we approach and administer acupuncture. Generally, again, going to back to that map of the meridians, most of the points that we're going to select are going to probably be on one of those pathways. It doesn't have to be only those pathways that we choose. The points could be anywhere on the body pretty much. But we're most likely to choose points on those pathways just because they're more effective and have a stronger results. Now, what you're seeing when they're kind of twirling or manipulating the needles, they're creating a stronger stimulus to that point. Now, there's some debate as to whether that's necessary. This is something we were all taught in school. A lot of times people will suggest that you don't really need to stimulate the needle that much more. You just have to insert it, and that's enough stimulation to the point to cause the effect that you're looking for.
So, of course, some of the questions I'm getting are, does it hurt?
Right, yes. That's probably the biggest question everybody
Yes.
asks. Well, one of the big things that we like to distinguish with acupuncture is the type of needle that we use. It's designed to be very, very thin, and it creates a very small sensation compared to any other needle that you've ever been poked with. Most of the needles people are familiar with would be like for those for like vaccinations or getting their blood drawn.
Thicker needles then.
Thicker needles. And so they create a bigger sensation. These are designed to be very thin, and they generate a very small sensation. Even when a person's stimulating the needle like they're doing right now, you don't really feel that. You know, you might feel a little pinch as the needle goes in initially, but after that, you can become very relaxed and not even feel or be aware of the presence of the needles. A lot of times, my patients will actually fall asleep on the table because they're so relaxed, and literally the needles kind of disappear for them. So I tell people honestly though, when you do receive the needles initially, like as she's inserting it there, you might feel a little pinch. It's not always guaranteed, but you know, I tell people ahead of time that's what you might experience, so that way there's no you know, hidden issue with what they might experience with it.
So there's no anesthetic or anything that's put on your skin, nothing that would prohibit. I mean, have you done it like that if someone is just comes in and they're deathly afraid of needles, or is it more beneficial to just insert the needles in?
It really isn't necessary, because there's so little sensation with the needle insertion that actually trying to apply some kind of anesthetic would just really negate the real process of what we're trying to do. And again, how many needles that we use, and
how
whether
many do you use?
right, and where we put them, and the type of stimulation is all going to be very independent based on each acupuncturist training and their own sort of style of how they administer it. How many we use? Well, obviously we have to use at least one needle, because otherwise we wouldn't be doing acupuncture. But there's no necessarily limit. One of the things that I always tell my patients when they first come in for the very initial visit, never had it before, I tell them I'm always going to monitor, and this is true whether it's your first visit or many times down the road, I always monitor their level of tolerance to what I'm doing. A person's going to have a change in their level of sensitivity from one visit to the next. So if it looks like they're doing really good, I feel a little more at liberty to do more needles. If it looks like they're having a little more sensitivity that day, I back off on the number of needles I use. So I'm always aware of what the person's tolerating.
Well, it's good to know that you are monitoring everything
Absolutely.
for them to, especially if someone's coming in and it might be like their first time and they're just a little bit squeamish, maybe, but I'm sure that you have a way of just making them feel very comfortable. Now, one of the other questions is, how long do the needles stay in? Do you just put the needles in and then you take them right back out, or how does that work?
That again it varies from one style to another. Generally, I think most acupuncturists are going to work in a format where they want to do a minimum of 15 minutes, probably maximum 45. I think most of us target about 30 minutes with retention of the needles, just because that's kind of standard, and it's kind of what we learned from most of our school training, and that's kind of what we apply. And it seems to be enough to be effective without necessarily reducing the amount that they're getting, without going overboard either.
Overboard, true. So within that amount of time, the 15 or 30 minutes, what is it that you're telling the person to do? Are you asking them to do some breathing? Because I know that you said, you know, the medicine is based on something holistic. So is there something in particular they should be doing? And how does one prepare for acupuncture? Like if you're coming in that day and it's your first day, should you have eaten? Should you have not? Tell me a little bit about that.
Yeah, in terms of preparation, I think people, you know, they should do their normal routines. That includes medications. Sometimes people are like, well, if I'm on pain medications and I'm coming for pain, maybe I shouldn't take my medication. You absolutely should take your medications. Do it as you're prescribed according to what your doctor has given to you. Meals, you know, everything else. You want to do your normal routine. I do suggest that you wear comfortable clothes that allow access to arms and legs. So if you need to roll up your pant legs or roll up your sleeves, Sometimes acupuncturists will have you change into gowns if they feel it's appropriate and need to have you face down and do points on your back or something like that. Most of the time, I would say for me, 95% of the time, you're going to be laying on your back, face up, and you're just needing access to arms and legs for the most part. So, wearing something comfortable there. I'm sorry, what was the other question that you started out with?
No, I was just saying, well, you answered my question. If someone were coming in, do they need any specific preparation?
Right.
What should they anticipate as they're laying there for the 30 minutes or however long it is? I
Right.
mean, are they going to be feeling specific sensations in their body? What happens there?
Generally, I'm going to tell them they want to relax during that period of time. And sometimes, if we have time, I'll actually guide them through a simple breathing method, to help them relax a little bit further. There's actually benefit and research that shows that doing certain breathing techniques helps you to kind of get out of that fight or flight mode and more into a rest, digest, and heal sort of state. And actually, acupuncture, that's one of the things that the science has been able to show is that just by getting the needles themselves will stimulate that switch from your fight or flight mode into a rest, digest, and heal state. So it's one of the ways that it's benefits, particularly with stress, anxieties, and such, But during that 30 minutes, we, from my standpoint, what we're going to do is we're going to dim the lights, put a little soft music on, and I step out of the room,
Sounds nice.
let them just relax. They have 30 minutes of just pure chance to just chill and not do anything. And like I said, some people actually get so relaxed they actually fall asleep.
Yes.
And if they don't,
imagine.
well, breathing is a good way to help relax too.
All right. So, what do people expect after it's over? Is there any specific care after you get off of this lovely bed and have been resting and relaxing to great music and the little needles are still in you? What can you anticipate afterwards? Is it like, oh my God, I feel amazing and better? or is this something that takes place over a period of time?
Both, actually. I've had quite a few patients that will have immediate changes, like literally as I'm beginning to insert needles. For example, if they're having a pain condition, their pain level might actually start to change before I even completely put all the needles in. So some people respond very quickly and immediately. Other people, it takes a little longer. They might actually have to have several treatments before they're able to start noticing much of a difference. Typically, I think that's more I'd say the typical response would be is that people need to go for several visits. We often talk about that in the treatment plan stage, where we don't expect immediate changes that are going to last forever. If I could do one and done, and that would be great, but it's not the case. So we usually have to do a series of treatments, and I usually start people out suggesting anywhere from 4 to 6 as a starting base. We're not expecting necessarily that whatever condition they're coming in for will resolve in that time frame. But that should give us an idea as to whether they're starting to respond to the treatments. And and then we kind of reevaluate and determine what we need to do next.
Now, one thing that you said that you do in advance, or as the person is lying down and you're about to put the needles in, obviously you want them to be comfortable and relaxed. But for some folks thinking there's needles going in, it might be a little bit difficult. But you also you take their pulse, or you're holding their wrist. Tell me about that, because you said it's not like a typical doctor taking their pulse.
Yeah, so we're trained in various assessment tools. So we're typically trained in doing like a pulse assessment or diagnosis, as well as what we refer to as a tongue diagnosis. So a lot of practitioners will look at your tongue. It gives them an idea of in terms of your health internally, and just looking at the tongue itself will be able to give them a better idea. Same with the pulse. Typically, when we're doing a pulse, like when a doctor is doing a pulse, they're probably looking at how fast your heart is beating. So they're going to count the heart rate by counting your pulse. While that's certainly important information, I'm actually looking for deeper qualities that are present in that pulse, meaning as I'm pressing down on the artery, it should have sort of a soft but firm, squishy water balloon sort of sensation. But sometimes if there's certain conditions present, it may cause the pulse to feel a little bit more constricted or maybe too expanded. And these all sort of signify to me what's kind of going on in their body. Plus, there's 3 different positions I'm relating to, and each of those positions on each side of the wrist, both left and right, are going to relate to different areas of your body. So it's a way for me to help assess what's going on with your health beyond just simply what you tell me and your symptoms.
It sounds great. We need to take a little bit of a break though. When we come back, hopefully we'll get a chance to talk about electroacupuncture.
Absolutely.
We'll take a quick break and we'll be right back.